This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday, and we appreciate you joining us on WAJR. We've got a completely full studio today. It's exciting to see people in person, to have them in the studio. Dr. Brian Huggins, health officer with Monongalia County Health Department. He's with us as he is every, last Monday of the month.
Last Monday of the month.
All right, so we appreciate you coming back in. And to my right is Anna Ash, breastfeeding peer counselor and certified breastfeeding specialist with the Monongalia County WIC office. And Anna, welcome to the show.
Thank you for having me.
Thank you for coming in. And also with us is Chrissy Rodeheaver, hospital liaison for the WIC agency and certified breastfeeding specialist. Good morning.
Thank you. Good morning.
Thanks for coming in. All right, let's first of all with some definitions. What is WIC?
Women's, infants, and children. So when you think of WIC, WIC are the people that are going to be there when you are getting ready to have a baby, when you've just had a baby. They're going to make sure that you have resources that you need. And these ladies are going to tell a little bit about that. They'll go into that. The highlight today is going to be one of their specialties is breastfeeding counseling because it's really important.
Yeah, so next month, meaning August, which is just today's the 28th, so just a few days away. Next month is Breastfeeding Awareness Month. So we're going to get into it in depth here about how important it is. So let's start with the basics. What is Breastfeeding Awareness Month about? And we'll start with you, Anna.
So Breastfeeding Awareness Month is all about, getting the community and the public at large to be curious about breastfeeding. And it's one of the easiest and most nutritious ways to sustain life in a newborn. And it was recognized in 2011 as the Breastfeeding Awareness Month. But really it started out as World Breastfeeding Week, which is August 1st through the 7th. We're really glad to talk about it.
Okay, so that's why you're here, to talk about the importance of it. So let's start with the health benefits. Chrissy, what are the benefits to a newborn life that enters this world that is breastfed from the moment he or she enters the atmosphere? How does that help the baby?
Oh, for sure. So, breastfeeding really starts at birth. It's one of those things that, mom and baby get the chance to bond. They do lots of skin to skin, but it also really sets the foundation for a baby all the way to their gut. It'll help to start, build that gut microbiome. It helps build their immune system. So through breastfeeding, they get all kinds of things immunologically, like they get all of the antibodies that mom has. They build a strong foundation for being healthier down the road. It really helps to decrease things like their risks of certain cancers, both in mom and in baby. It helps them avoid diabetes down the road. All kinds of, really great benefits. There's a decrease in risks for SIDS, which is sudden infant death syndrome that, plagues a lot of families with their children. Easier for baby to, digest than formula. Breast milk is one of those things that at its, foundation core, it's easy for baby's system to break down. Whereas formula, it's got a lot of stuff. Your body has to work really hard to break it down. And you want babies to work as little as possible for their nutrition. So it's just one of those things that's far easier for them.
So it is safer, it is the most nutritious, and there are all kinds of benefits in terms of long-range disease and digestion issues.
Absolutely.
It's amazing that something so simple can be that important.
Yeah, and Kyle, and I really want to stress the antibody side of it. So when a baby's born, their immune system is still learning. And through breast milk, especially that first 6 months, you really get this extra protection. Mom is able to pass some of that protection over to the baby through that breast milk. And that's why there's a lot of vaccines, kids can't get until they're 1 year old. Sometimes at 6 months, if it's an emergency, you can give the kid the vaccine. So there's really not going to be extra protection that you can try to get to the child. And that it really is one of those marvels of human body, right? Yeah. That we're able to do that for our basically our new children into the world.
Yeah. Again, the antibodies and the immune system, they're pretty much in sync, right? With the child and the mother, one passes along to the other.
Absolutely. And every time a child breastfeeds, they're giving the mother a DNA like communication back to mom, and it tells the mother's milk like what baby needs more of, or like if the baby's sick, the mother's milk will produce what baby needs for like the next breastfeeding moment that they have together. The baby's getting that like immediately. It's just a very fast communication between them.
Okay.
Yeah.
What are the health benefits to the mom?
Ooh, so there's a lower risk of things like breast cancer and certain reproductive cancers. There's a lower risk of diabetes for her as well. You know, a lot of people, you know, postpartum want to focus on, you know, mom needs to get herself back in shape, you know, things like that. So it can really help to stabilize mom's metabolism, help her lose weight postpartum, things like that. And, you know, it just helps to regulate her body in general in the postpartum period. It eases those hormones a little bit. You actually have a lower risk of postpartum depression when you're breastfeeding because your body can regulate a little bit better if you are continuing to sustain that life that you just grew. So it's the benefits are great.
You actually burn calories, right? Like
You do,
breastfeeding,
yeah.
you actually burn calories while you're breastfeeding.
Yeah. And it's funny because you need like an extra, 500 calories a day in order just to make milk. And that's just your body working hard to pull from your own stores to make that milk. So, you know, it's also really important that moms support themselves with a great diet of calcium and things like that so that their body doesn't start to pull from their own bone and teeth stores. So, you know, it's really important to have a well-balanced diet while you do it as well.
Mm-hmm. Okay, one of you, I don't remember which one, but one of you mentioned skin to skin with mother and infant. So what are the benefits there?
So skin to skin is great for a couple of reasons. One, bonding. We so often see in our society, you know, let the baby cry it out and things like that, where when you should be doing skin to skin, it's going to calm the baby down. And if the baby is calm, then their body is functioning correctly. If mom is calm, because if you have a crying baby, mom is also frustrated. Yes, It brings mom's stress level down. But it's not just great for mom, too. It's great for dad. That's one of the things that we talk about at WIC a lot when partners come in together and they want to feed baby. So they want to feed from a bottle. And it's like, hey, you know what? What if we just let mom do the feeding from the breast and then dad can do skin to skin? And it's hormonal balancing for dad as well. It's bonding with baby in a way maybe they hadn't thought of before. But it regulates all of those hormones in mom and dad.
Mm-hmm.
It's also really important post-birth. So, you know, the gold standard in both of the hospitals here in Morgantown is that mom gets an uninterrupted 2 hours of skin-to-skin time after baby is born. And that can help things like baby's body temperature to regulate, their blood sugar to regulate. It can help with mom's oxytocin levels to help her bleeding levels after birth and things like that. So, you know, there's a lot of regulation that happens when you bring a baby here. And I mean, think about it. They spent 9 months inside mom. Where do they want to be?
Yeah, with
mom. They want to be with mom. Yeah.
So, yeah, absolutely. Okay, so we talked about the importance of this, the breastfeeding, but it's not necessarily easy all the time. So there are some ways, that's where your training comes in, where it is significant to help moms along with a process that sometimes, I would imagine for some people it's a snap, right?
Sometimes
some
it can
people
be.
it can be easy, but for most it's a little bit of work. So you've got to put the effort into it, and moms are tired and they're we mentioned stress, they're stressed out. So what can you do to help someone make this work?
I like to tell them about the 3 Ps of breastfeeding.
Yeah.
Because like you said, the exception to the rule is that mom who has a great experience straight off of, having birth, getting baby to latch, and then going from there. But whenever you have those people who are struggling, they need to have patience. Sorry about that.
It's okay.
And practice and persistence. The baby is learning. This is their first time being in the world. They're not going to just get it immediately most of the time. So it takes lots of practice, which can lead to frustration. And sometimes moms give up due to the frustration. But if they can just have some patience and persevere through that, then they can have a really successful story.
Yeah, both sides benefit. Everyone benefits.
Yeah.
Okay. So you have a personal story?
I do.
Okay.
So I was lucky enough to breastfeed all of my children, and I have 3 girls, and they were all born at 3 very different stages of my life, and 3 very different journeys. I like to remind people that while it might be this natural thing to do, it's not always easy. And so, when it came time to feed my own, I had done all this research and I knew that I really wanted to do this and it was really important to me. But then I ended up with 3 girls, all who had jaundice, which are not super easy things to breastfeed through. You've got to have baby under the billy lights. And, my first, she was a little early, born at 37 weeks. So, she was a sleepy nurser. I pumped a lot for her. And my other 2 were born at 39 weeks, and the first 2 journeys were okay. But my last journey, her jaundice levels were so high, she had to be put in the NICU. And it was a devastating moment for me. Like, there is something super unnatural about walking out of the hospital without your baby when you go home. And we were in the NICU for about the better part of the next 2 weeks. I pumped a lot. We had a lot of feeding trauma. And I swear, had it not been for the ladies at WIC, I think I'd have given up. It was really difficult. And I had so much support from Lynn and Michelle at the WIC office, and they called and checked on me. They brought me in for their appointments with my first. She was a Christmas Eve baby, so there was no lactation help outside of that. So when I came in the day after Christmas and I was like, I have no idea what I'm doing, they were there for me. And it was a different journey with all 3 of them, but one of the most rewarding experiences of my life. And I'm very proud of myself for it.
So now you've given a part of your time to helping others, right?
Yeah.
To finding the fit, someone that can help.
Yeah. Yeah. I know what it's like to not have it. And my biggest thing is, like, unless I am out of town for some weird reason, I will always be at the WIC office the day it opens after Christmas.
Well, and we as guys, and that's a perfect example. We think, why do you need them? Right? Because you just think it's intuitive. Oh, you have baby, you have breast.
Mm-hmm.
Yeah.
What is the problem here, right? Like why do you need this help? And it's not that intuitive. It seems like it should be just plug and play, right?
For sure.
But it's not that easy.
No, it's not. And while it might be a really natural thing to do, you and baby still both have to learn how to do it. And the journey there can be a little tumultuous at times, but the most important part of that is having the support to get through it. And that's literally what our whole job is making sure we build that foundational support so that mom knows she's got somebody she can come to. She has somebody she can rely on. And we take that job very, very, very seriously.
Mm-hmm.
In hearing all the health benefits, people still choose not to. So talk about that a little bit and what you would, I know I'm jumping ahead a little bit, but
That's great. So Chrissy and I had the opportunity to take the Appalachian Breastfeeding Network Latch Leadership Training a couple of months ago. And it really changed our perspective on how we work with breastfeeding moms, especially in the Appalachian culture. Our demographic of people rely on family support. And if they're coming from a lineage of mothers who didn't breastfeed, and now they're kind of wanting to
break that mold a little bit.
Yeah, break that mold and do their own thing. They're not necessarily getting that family support because, we formula fed. Why would you want to do it that way? And, that sounds so simple, but it can be devastating to a mom who is looking for support. Like, I was kind of hoping that you could, go on this journey with me in breastfeeding. And, if you don't have that support, what if grandma's watching baby? I got formula in the cabinet. You don't need to pump while you're at work. I'll take care of it. And that happens more frequently than you could imagine. And then as far as health benefits, Appalachian culture can be very fatalistic, where it's like, well, I can't really change my health. It just is what it is.
Right. Doesn't matter what I do.
I'm not going to seek help for it because, my grandfather had diabetes and his grandfather had diabetes. And then not wanting to seek the support that you have available to you because we're just hard workers and we're just going to work through it. And we're really trying to break through those mindsets to get these moms to come who need help, who would, love to breastfeed, but just don't have the support from cultural stigmas.
All right, well, let's move in that direction because we're rapidly running out of time. This is going very, very quickly. So how can you help? How can WIC help if someone is out there listening, dealing with some of those issues that you just described? How can you help?
Oh, call us. That's the biggest thing. Get us on the phone. Talk to us for a little bit. Even if you're on the edge of like, oh my God, I'm going to give up, pick up the phone. It doesn't matter if you're a WIC support. It doesn't matter if you're a WIC participant. If you need help, we can connect you with community resources. We can just talk to you a little bit on the phone. For our participants, they come in, we offer weighted feeds. We offer that support. The number of times we've had moms just sit in our chair, just talk to us and unload and get it all off of their chest. Sometimes you just need somebody to talk to as well. We have our hospital liaison program, and not to toot my own horn a little bit, but I think we're doing really, really well with it. And it's really important because it sets a foundation of support and continuity of care. So people, especially who birth at Children's and get to interact with me, they know that once they leave the hospital, we aren't going to just leave them. They have somewhere they can go. I schedule them for a follow-up. They come in, we check in. How's it going? Because if it's something that you're struggling with, getting help early, that early intervention is really important to be successful. And so we bring them in, even though they have all their benefits, they're ready to go. In the hospital program, we want to make sure that we're here for you. And so we continue to build that relationship. We talk about their mental health. We do all the other things. And we meet them where they're at to see what they need. And we try our best to meet them there.
What number can folks call for help?
Ooh.
Is there a WIC office number?
304-598-5181.
Yep.
598-5181.
Yes. And we also have our breastfeeding classes are free to the public. That's something, again, people are like, oh, I don't have WIC. I can't take that class. You absolutely can.
Oh, 100%.
And then another way that people can reach us is, with World Breastfeeding Week coming up very soon, in the Harrison County at the Meadowbrook Mall, we're having a baby buggy stroller event on August 6th from 10 to 2. And then here in Morgantown, we are bringing back the breastfeeding awareness walk. It was something that was really big before COVID. We actually just got a proclamation from the mayor on Tuesday about making the breastfeeding awareness walk an annual event on August 7th every year now. And this year, we're going to be at the Farmers Market Pavilion from 6 to 8 p.m. We have lots of community resources for moms and pregnant people, but we also wanted to bring the community at large. So we got some food trucks, like we're going to go walk around downtown. Breastfeeding is something that's very intimate to mothers and babies. But getting the information out there to the public, maybe there's a mom that doesn't know she's going to be a mom yet and hasn't made that choice. Or there's a man out there who's, just would love to be a father one day. And we're going to have all kinds of information there for them too.
Okay. So again, that number for any of the information on any of those things that you just said, 598-5181.
Yep.
So the event in Clarksburg and Meadowbrook Mall, it's the baby buggy Am I showing my age? Wasn't that a Lucy?
Rubber baby,
Little
rubber baby
bit,
buggy,
yeah.
buggy bumpers.
Yeah.
Rubber baby
Yeah.
buggy bumpers. There we
Rubber
go.
baby buggy bumpers.
Yep.
Yeah, that was a I Love Lucy episode. So I guess you're as old as I am.
Hey,
remember
I have
that.
a Lucy for a reason. One of my kids is Lucy. It was my grandma's favorite show.
Is that
So,
right?
oh,
Okay, well
yeah.
there you go. So
Yeah.
you know all about
I
rubber
sure do.
baby buggy bumpers. All right, well, guys, we're almost completely out of time. This was great information, and you come with a 3-page outline. We got through about a page and a half, but
Yeah.
I apologize for that. You got the essential information. out.
Yeah.
Yeah, I wanted to be over prepared because we could literally talk about this until we're blue in the face.
It's
so
true.
thank you for giving us this platform
Yeah.
to do so.
Thank
Yeah,
you.
well, thank you for coming in. We appreciate it.
Yep. And one last thing is at the county fair. So
Oh,
there's
yeah.
also going to be a WIC breastfeeding tent. You guys have this amazing tent.
We do.
That's got this cute little furniture in it. And women that are out in the fair, it's hot.
Mm-hmm.
And if you need to take time to breastfeed, there's going to be a private space that you can go to, and you're going to be able to do that. It's going to
Yep.
be great.
We got fans, little rocking chairs,
Wow.
place to change your baby.
That's outstanding.
One
Okay,
last little plug.
That at the county fair. Very good. Okay, so if you joined in the middle of us, I introduced our guest at the beginning. Anna Ash, breastfeeding peer counselor and certified breastfeeding specialist with Montague County WIC office. Chrissy Rhoda Heaver, hospital liaison for the WIC agency and certified breastfeeding specialist. And as you could tell, no matter what point you join the conversation, they know their stuff. So call them. They can help you. 598-5181. That is the WIC office. And, of course, Dr. Brian Huggins, health officer, Montague County Health Department. We'll see you again next month.
Always.
All right. Again, great information. We appreciate your time. And that number to call once again, 598-5181. That is Mon Health Talk for this Monday. Thanks for joining us on WAJR.